Good morning, and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Good morning. Doing fine.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing a viewer-submitted question as well as the latest studies and headlines through today, May 1st. We welcome any questions or comments down below and, of course, through any of our social media, including Dr. Murphy's Substack page, where you can get the references and summaries of all the topics we talk about today directly to your email inbox. Starting with that submitted question, a great one today. Is there an adult vaccine for rotavirus? If you got the vaccine as a child, does it still protect you later in life?
Well, rotavirus causes very bad diarrhea in very young children, and particularly those 3 months to 3 years of age. They just can't handle the dehydration from that much diarrhea, and they don't have any immunity left after the mother's antibodies are gone. Adults, it's a pretty mild disease, and people are basically they're not dying about rotavirus disease. Um, Adults don't need it. It's not approved for use in adults, and they probably had it in the past. They probably have some immunity, so they don't need it. It's really just for children, and the younger, the better. That's really the story of the rotavirus vaccine. So adults really don't have to worry about it.
Very good to know. And we have a big COVID story today comparing how many people are still dying to other big problems we have here. Can you tell us the numbers?
Well, the people are still dying from COVID. Now, this is on top of the people that die every year from influenza. It looks like COVID is still probably a little bit more than influenza. It's a worse disease. Um, and people are writing it off. Oh, COVID is gone. It's not there, whatever. However, in this study that was reported by Public Citizen, but comes from other data, the number of people per year dying of breast cancer or prostate cancer is about the same, if not less, than the people dying of COVID. So if you're worrying about breast cancer or prostate cancer, you something you're also very likely to get is COVID, especially if you have any kind of underlying disease or you're an older person. So I think it's important that we put it into perspective and that COVID's not gone. COVID is here to stay. It's not going away. And so just like with the flu, keep up with your vaccination schedule. There's a new vaccine coming out in the fall that is more targeted at the circulating COVID that's floating around the world today. And stay up to date, just like with your flu
Mhm.
vaccine.
Very good advice there. And while we're on the topic of flu now, there is some new study data about a high dose recombinant flu vaccine. Can you remind us what that is and tell us about the data?
Yeah, there's a large phase 4. This is after approval, phase 4 trial published in Lancet Infectious Diseases. This is an Australian and Singaporean research group funded by Sanofi, who makes the vaccine. So why is this important? Well, the flu vaccine used to be made in eggs, chicken eggs, very, very old technology, and there just was no interest in modernizing things. Recombinant vaccines are made, where they build the viral particles, it's a viral particle, not a live virus. And, this is also not a new technology, but it's newer than the egg technology. And this study just shows that the response with this recombinant vaccine is 3 times greater than what they were getting with the older egg variety. And so That's just really good news. We can get away from the eggs. And then there's also mRNA technology, like we had with COVID. Those vaccines are also being made, but this is about the recombinant vaccine one. And I think there would be, more public acceptance of a recombinant vaccine than an mRNA vaccine in some groups of people. But regardless, this is a really good vaccine that looks like it works better than the old vaccine.
Which is very good news. And I understand that looking specifically at pediatric flu patients, there were some estimates done out of a conference recently talking about what that uptake, increase in vaccine uptake, I should say, could do. Could you break it
Yeah.
down?
So the flu vaccine is recommended for everybody 6 months of age and older. The uptake is low. It's low in adults and it's low in children. And but they can do estimates of what happens with disease, hospitalization, and deaths based on the proportion of of children, in this case, who have taken the vaccine or not taken the vaccine. So, if say the current US pediatric flu vaccination rate is about 50%, if it was increased up to 70%, the difference in that 20%, because, we're a very big country with a lot of people in it, it would prevent more than 2.2 million outpatient visits. That's a lot of visits. 30,000 hospitalizations. That's massive. And 123 uh, flu season deaths. So the hospitalizations are important now because I'm sure people have read about or they are very aware that many of the pediatric hospital units in the United States have closed. Many hospitals can't keep three shifts of people for a unit that has one, two, or three, just a few patients in it. It's economically not viable. So lowering the hospitalization by 30,000 deaths, around the country, I mean, that would have a huge impact. And especially since the number of beds is getting less and less over time. And just to put it in perspective, in the 24-25 flu season, 2022, 2024 to 2025, there were 293 pediatric deaths from flu. This is not insignificant. Um, the highest number, that's the highest number that since they began reporting these cases. In the past year, we've had 149 deaths already. So, it's a deadly disease in very young kids, and we can prevent a lot of hospitalizations and deaths and visits.
In that same vein, and rounding out our respiratory coverage for today, we have a great retrospective look on how effective the RSV treatment for young infant ones,
Mhm.
protecting them, keeping them out of the hospital. Can you bring us those numbers as well?
So RSV is another one of the respiratory viruses. So these are the respiratory season really is flu, COVID, and RSV. So RSV is particularly bad in very old people and in very young people, under a year of age, actually. They have never been exposed to it. They just get it and they get really sick and can end up in the hospital, ICU, emergency departments, whatever, and they can die from it. So anyhow, um, there is a monoclonal antibody that named Beyfortus, which can be given to kids under a year and under 2 years if they have an immunocompromised condition. And this antibody prevents RSV, or if you get RSV, it's much milder. And so what they found was there was a greater than 40% reduction in RSV-related hospitalizations and emergency department visits in infants 7 months and younger during the 2024-25 respiratory season. And then in a separate cohort study of over 400,000 infants reinforced these findings, showed that those that got the antibody, it's a treatment, were 71 to 77% decreased risk of hospitalization. That's a massive number. As mentioned with the flu, this is RSV now. And after a year of age, the whole thing becomes less important in children. So it's just these young babies. They just cannot handle this virus. In the US, just to put it all in perspective, there's in a typical year, 56 to 80,000 hospitalizations occur and 100 to 500 deaths annually in children under 5. So it's a tough disease in kids, just like the flu. It not completely preventable, but a very significant reduction if this monoclonal antibody is used. Another way they protect babies is to give the mother the RSV vaccine, which is approved, in the third trimester. And then the mother's antibodies pass to the baby. And there's been other studies that have shown maybe this Beyfortus works a little bit better, but either way, there's a benefit. So that's another option that people have.
And our final story today, catching back up on the measles outbreaks here in the United States. Good news out of South Carolina, but bad news out of other areas. Can you bring us the latest?
Yeah, so South Carolina has officially ended its measles outbreak with almost 1,000 cases in total of the 1,841 in the entire United States. I mean, South Carolina was just really decimated. It's over. 42 days without a new case, and it's the single largest U.S. measles outbreak in over 30 years. All right. We had the 3 deaths from the measles, 2 in kids and 1 adult. None of them vaccinated. So it's this is great. However, the number of cases hasn't gone down to 0 in the country. Utah has now taken over with over 400 cases. And in the entire Americas, the head of PAHO, the Pan American Health Organization, which is older than the WHO or the CDC, I think, is it's surging throughout the Americas. So it might not be older than the CDC, but it's definitely older than the WHO. But anyway, the cases in the entire Americas are over 15,000. So it's not a problem limited to the United States. Canada had a worse outbreak than we did. Many of the European countries also. So whenever that vaccine rate drops below 93 to 95%, you're going to get outbreaks. Keep in mind, in 2000, when we had very good measles vaccine coverage in the United States, we had 0 cases.
And in South Carolina specifically, CDC and public health efforts led to more than 81,000 doses of the measles vaccine being given to help quell this outbreak.
Yeah.
So it just shows you the scale of how much you really have to do to fight
Oh,
measles.
yeah. Amazing.
Amazing work. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise answering our viewer submitted question and helping us understand all the latest data.
Well, great, Katie. Thank you.
And thank you all for joining us for Ask Dr. Murphy this week in public health. We hope to see you back next week. And as always, all questions and comments are welcome down below or any of our social media linked in the description. Have a nice weekend.